I'm not sure who can answer this, but I'm hoping that Dr. Gustafson might be able to give us some insight into what's being done to try to keep track of all of this, because Washington state vaccinations are lagging behind BC right now, and there are many people in Washington state that are refusing to get vaccinated. So how concerned are you about the border possibly opening up too soon and more people from Washington state who may not be vaccinated trying to visit British Columbia?
Thank you for your question. The single most important way we can protect ourselves is to ensure that we ourselves, we as a community, are immune. Throughout the world and throughout the pandemic, and once the pandemic is declared over, there will be reintroductions of COVID-19 to British Columbia. And of course, the likelihood of reintroductions is higher when the population from where people are coming is less immunized. However, we actually have the means of preventing an introduction of an infection into turning into a local outbreak by getting ourselves immunized. We certainly hope that jurisdictions around us will continue to make efforts to immunize their population both near and far. We need to make sure that vaccines are available to every country around the globe. But in terms of the impact of immunization rates from other parts of the world on us, the single most important thing we can do and the single most effective thing we can do is making sure that we have high rates of immunization here in British Columbia, and Minister Dix may have something to add to that.
Just to say this, I think agree with what Dr. Gustafson has said, of course, and just to say that it's our expectation in the coming months that the federal government may take some actions in concert with the U.S. government and with other governments to increase access to Canada. I think in the coming months, given what's happening to test positivity in our province, which today was 3.51%, and what's happening to test positivity in other jurisdictions, that is inevitable. But that will require a whole series of measures to ensure that we stay safe, and I'm sure that those are measures and something we're in regular contact with the federal government, that in advance of all that, the federal government is working on. I know this is something that will be the subject of the Premier's discussions with the Prime Minister, is discussions by Dr. Henry and Dr. Gustafson with their colleagues in other provinces. So it may be in the coming months that we have a loosening of restrictions at the border, and that will be decided, obviously, and is decided at the federal level. But what's important for everyone is that when that happens, steps be taken to ensure that we stay safe, and it would be my expectation that the federal government will do that.
But I'm wondering about, I've heard a reference today to the borders opening in the coming months, and I'm just wondering, I know it's a federal government decision in their jurisdiction, but obviously public health have the lobby for what they think is right and safe. What is your best guess as to when the border will open, or educated guess, I should say? Do you think it will be the month of August? Do you think it'll be September? Can you give us some insight as to when you think it should open? And if there's any metrics as in terms of vaccination counts here you'd like to see before you encourage that?
Yeah, educated guesses about my future educated guesses, I guess, Rob. I think fundamentally, we have to continue to do what we've been doing, which is to reduce transmission, follow public health guidance. Oh. Sorry, there was a technical problem here, I think. Okay, sorry. Just, I think, let's start again, because we had, I think, a technical issue. Just say, Rob, that I think that I'm not going to make any educated guesses. I think what we try and do, and consistently do, as we did last summer, months in advance, is prepare for eventualities. And so that's what we do all of the time in terms of the COVID-19 pandemic increasing. Last summer, for example, dramatically, the number of people who did contact tracing in BC, for example, in advance of the fall. So that's a federal government decision, and it's based on I'm sure, many of the same metrics that we look at. But this is something that the premiers and prime ministers are talking about, that the provincial health officer and Dr. Gustafson talks about with her colleagues and gives advice on. But I think the key question that we'll want to see answered is what steps are being taken when those things occur, to ensure that we continue to be safe. And those are the things that I know that the federal government is working on, and of course they must be working on.
And we'll now go to Dr. Gustafson in Vancouver.
Thank you. So the only thing I really have to add to that is just the importance of remembering that the border is long and involves all of Canada, and this is something that we discuss with our federal colleagues. And the decision will take into consideration things like the rate of transmission, rate of infection south of the border, and the level of immunity in Canada overall. Because again, both of those factors are really important in that decision from a public health perspective.